Post-op blepharoplasty, third week. Is it possible to revise within 1 month? My swelling is almost gone, but I found that my left eyelid has ectropion, which doesn't go away with time. Both of my eyes have a deep fold and high fold, which I don't like at all. I look horrible. Is it possible to revise within 1 month? If I insist on revision, what's the complication?
Thank you for your question. You submitted your question with 2 photos, and you state you're about 3 weeks to about a month out after having upper and lower eyelid surgery. And you're concerned because you feel your creases are too high and that your left eye has an ectropion. And you are insisting on revision, and you're asking if it's appropriate or feasible at 1 month. Well, I can certainly share with you how I advise patients who come to me from all over the world for revision eyelid surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping patients who have had complications from eyelid surgery done elsewhere has been a very big part of my practice. And essentially, I can give you some of the guidelines that I tell my patients who consult with me as early as 1 month after surgery. So to begin with, we'll start with what is a essentially central idea as to what to do and when to do something to help with the appearance versus functionality. So there are times when patients have come to me and they've had severe ectropion where the eyelid was significantly everted and that they needed surgery sooner rather than later because of potential compromise in eye function. So essentially, the urgency of revision surgery is dependent a lot on the quality of the integrity of the eye itself. The eyelids, besides appearance, it's important to understand that eyelids that look good function well. And so if there's an ectropion or retraction, it doesn't mean that it always has to be addressed immediately. But if it's more severe, where eye function is compromised, then surgery is done. Generally speaking, if it's mild or minimal, you can treat the surface of the eye conservatively. You can use artificial tears and you can do other things to help just buy some time to allow for some of the healing process to stabilize. There is always an important variable, which is the relative stability of the eye appearance, that is important to me when I do revision eyelid surgery. When I do any kind of revision, so let's use just the lower eyelids for example. If someone's eyelid is only done, let's say, a month ago, like yours, then there is still opportunity for healing, such that if the eyelids are a little bit low, you can massage, you can do other more conservative things to help encourage healing, and you might get a millimeter or so or more of vertical height restored. And after 3 to 6 months, you might be in a better situation and may or may not need revision surgery. And if you do need revision surgery, at least we're not working with what I would refer to as a moving target. When there's a lot of variability, when there is still swelling, when there is scar tissue, it sometimes is challenging. Now, a lot of times patients come to me after they've had multiple revision surgeries, and in those situations, I actually have to help rehabilitate the tissue, and so I'll do things such as use platelet-rich plasma, acellular matrix to help rehabilitate the tissue before doing surgery. But specific to your situation, I think first of all it's very important to not just abandon your doctor. If you chose your doctor based on a trust that was developed after consultation and establishing an understanding and confidence in their experience and ability to do your surgery, it is still in your best interest to first work with the doctor who performed the procedure. That doctor knows your anatomy, understands what was done at the time of surgery, and may be able to help you get through this this healing process and get you to closer to where you want to be. A lot of times, it is often the desire for every patient and every doctor to avoid any complication in every patient or in every situation. But the reality of dealing with a human being is that complications do occur. Infections, scarring, wound healing that wasn't anticipated happens to anyone who performs, any patient and any physician who performs surgery will recognize that these are things that do happen. So I think it's still important that you not just abandon ship, but at least work with your doctor. As long as your eye health is not being compromised, you have some time before you can address the aesthetic issues and the functional issues. That being said, if for any reason you feel like your doctor is not attending to your concerns, there's always an opportunity to get a second opinion from a specialist, from someone who is an expert at eyelid surgery, just to get an opinion. But I would say that a lot of times when patients have come to me for this type of opinion, I essentially document with photos and examination what they look like at that point, and then I follow them and I see them at 3 months, 6 months and beyond, and watch how they do before considering doing any type of revision surgery. So the principles again are about maintaining and protecting the eye in terms of ocular health, making sure that lubrication and there's no issue with vision compromise, and further ensuring proper wound healing and then stability before undergoing any revision procedure. So I hope that was helpful. I wish you the best of luck. Thank you for your question.